Dr. Rena Bray is Medical Director of the Environmental Health Clinic at Women's College Hospital and Assistant Professor in the Department of Family and Community Medicine at the University of Toronto in Canada.
Hello, my name is Dr. Rena Bray, and I'm going to be speaking with you today about clinical observations and recommended practice guidelines for the management of EHS patients. I am currently Medical Director of the Environmental Health Clinic at Women's College Hospital, University of Toronto, and Assistant Professor at the Department of Family and Community Medicine, cross-appointed to the Dalla Lana School of Public Health. I have my email address on this slide in case you would like to reach out and ask me any questions about my talk today. Working at the Environmental Health Clinic has been a wonderful experience. We have been seeing patients with chronic complex conditions related to environmental health issues for over 25 years. Over the last 15 years, we've seen a huge surge of what's called electromagnetic hypersensitivity. This is defined as an awareness or adverse symptomatology in the response to electromagnetic fields of multiple types. We've discovered so many gaps in knowledge and understanding in this area of medicine. And really what we've discovered is it really isn't as gender specific as we initially thought. And there's quite a bit of overlap with multiple chemical sensitivities. The multiple chemical sensitivity consensus case criteria are here in this slide. And the patterns and symptoms are also reported for sensitivities to electromagnetic phenomenon. The exposures of electromagnetic fields are not seen and very difficult to measure in a person. And it also compounds with other exposures that are well known in our environment through the air, soil, water, food, breast milk, consumer products, and through in utero situations. And so it sort of takes on a different mode of action, and it's much harder to trace. The body can deal with everyday chemicals through phase 1 and phase 2 pathways in the liver and other detoxification centers of the body with the use of vitamins and cofactors and other substrates. But the question is, how do we deal with electromagnetic field impacts on the body? So the way we look at it at the Environmental Health Clinic at the University of Toronto is basically starting with the total load model, where a person is like a barrel. And over the years, they start filling this barrel with chemicals and other types of exposures, things that stress the body, including their own genetic makeup, which prevents them from properly dealing with whatever comes their way. And so if you look at all the stressors on the body, even from the time in utero to the present moment, it's sort of gives a history and leads up to a situation sometimes where the barrel becomes full and a person becomes symptomatic. And radiation is one of those stressors on the body. In order to empty out the barrel or to reduce the amount of load, we need to do some detoxification strategies through depuration and helping with the kidney and the gut integrity, etc. So electromagnetic hypersensitivity is a functional impairment. It's a spectrum disorder, and genetic polymorphisms increase a person's vulnerability. So we need to be cognizant of that. I've talked about the total body burden over time. And Dr. Havas's find mnemonic is with frequency, intensity, nearness, and duration, definitely is something to be considered. It's recognized as a disability under the Canadian Human Rights Commission, mostly on the federal level, and we're working for more provincial understanding. Patients can react to electrical fields, magnetic fields, dirty electricity, radio frequency radiation, and electrosmog. And these have been alluded to in previous talks. The gene-environment interaction is incredibly important. That, as well as nutritional status, helping a person figure out how to actually get rid of whatever is impacting on them. And if they're not eating properly, that they're going to be in a more vulnerable state. Again, the nature, dose, and timing of their exposures, and then their overall stress load that they have, what's called the allostatic load, or the wear and tear on their body. That leads to exhaustion after years of trying to adapt to a stress or stressors. The body just sort of says that's enough. And that's a really important component to understanding how people become vulnerable to electromagnetic fields. Belpom explains EHS as being genuine with some suggestive biomarkers, although there's no gold standard. Genetic polymorphisms are involved, and that there is cerebral hypoperfusion, hypoxia-related neuroinflammation, and decompensation. Radiofrequency radiation causes dermatological problems, DNA damage, cardiac and nervous system disruption, and through a series of cascades through the peroxynitrite system and chronic inflammation and mitochondrial function, people become quite fatigued and develop pain complexes. The adverse biological effects, other than the thermal, and that is just heating of the skin and the body, is the non-thermal part, which involves DNA damage, voltage-gated calcium ion channel disruption, immune system suppression, blood-brain barrier permeability increase, thickening of the blood, effects on cardiovascular, neurological, and endocrine systems, problems with cognition, and sleep abnormalities. The clinical findings, by and large, are not specific. It's a multi-morbid picture where there are various things going on, and taking a proper exposure history allows us to delineate exactly what's going on so that the issues can be dealt with one at a time, and it helps us take the load off the patient in order for healing to begin. So the basic rules to help with diagnosis and management include an exposure history, which I will allude to shortly. Lots of questionnaires are given out. You have to rule out other illnesses and diseases and do a proper physical exam, especially focusing on the neurological, dermatological, and cardiac issues. Blood tests are expensive and often not available where we are. And some of them are very non-specific, but they give you a feeling as to what might be you might be able to fix in order to improve the health of the individual overall and make them more robust. We find household members to be the best litmus paper test, because often, without even knowing, they're doing double-blind experiments at home, and they finally realize that their loved ones are not crazy. There are lots of conflicts that arise from this illness, a lot of family conflicts, child custody battles, labeling, stigmatization. And then when everyone finally comes into the office and says, you know, they're right, they're not lying, they're not making it up, we all, you know, breathe a big sigh of relief and we get down to business. Because these poor people really become quite anxious and can even seem paranoid when really they're not. They just don't know what's going on, and they can't see what's going on. So the symptoms that we see often are listed here. There are many, but the big ones are things like tinnitus and racing heart, sleep problems, fatigue, headaches, heart palpitations, memory problems, vertigo. Again, a picture of the total load to remind you to think about all of those various things that can stress the body, including depression, abuse, trauma, that can throw your whole system off. Mold, workplace exposures, viruses, allergy sensitivities, heavy metals, etc. It's important to remember that the body is an electrical organism, basically, and that we have electric fields inside and out. So here's a slide of the mnemonic to do an exposure history. We follow the CH2OPD2 mnemonics: C, community; H2, home and hobbies; O, occupational or school; P, personal; and D2, diet and drugs. After that's done, we start doing category work to see where these patients fall. And category 1 looks at toxic metal body burden, looking in particular for mercury. It seems to be quite prevalent in our society from mercury amalgam use, as well as fish that's eaten. And in Canada, a lot of lake fish is eaten, and a lot of the lake fish is contaminated with mercury. Category 2 looks at Lyme disease and other co-infections and infections that impact on the nervous system. And this can cause an increased vulnerability to electromagnetic fields because of the effects on the membranes along the nerves. We see people with tremor, dysarthria, ataxia, extreme fatigue and headaches, cognitive disturbances, and mood disturbances. We find that if you treat the Lyme, the situation gets better. And if there's a good detoxification protocol and antioxidant therapy, including some oxygen use, it can be very helpful for the hypoperfusion issues that occur in the brain. Category 3 looks at those people with CNS lesions or inflammation or neurodegenerative diseases. So things like multiple sclerosis or neurotoxic pesticide exposures, problems with white matter demyelination, sometimes simple aging and dementia can predispose a person. And they present again with the similar types of signs and symptoms we've discussed. Category 4 looks at heart rhythm disturbances. For people who have a predisposition already, they can have tachycardia, PVCs, PACs, atrial flutter, and atrial fibrillation. Wolff-Parkinson-White syndrome also increases the risk of sudden cardiac arrest for those exposed to EMFs. And sleep can be particularly impacted upon when the heart isn't able to relax. So patients can be waking up throughout the night, and it can be very alarming having cardiac symptoms. So just a reminder that the heart is an electrical organ, and it is incredibly sensitive to electromagnetic fields. Category 5 in its own right is just basically all the students and teachers that come through the door. They are already at very high risk. Students in particular who aren't getting enough sleep, probably not eating very well, and studying night and day around electronic equipment, wondering why they feel so awful, and just sort of attributing that to stress and lack of sleep and what have you, but not really understanding that it might just be the fact that there's just tons of electromagnetic fields around where they're working, wires and computers and routers and the whole gambit. Lots of fluorescent lights in the lecture halls, etc. And now with COVID, there's a lot of use, but from home, thankfully, hopefully not enough fluorescent lights as you'd get at the university. Finally, category 4 are just phobias. A very small minority of patients for mental health reasons mostly are not sure what's going on. And we get this nocebo phenomenon in which inert substances or mere suggestions of substances actually bring about negative effects. These poor patients become very anxious and benefit from what's called dynamic neural retraining. Even patients who don't have these problems benefit from this program. So it's something to consider and look into as well. The diagnostic testing is quite intricate. And again, as I said, it's very hard to order some of these tests. Most of them are research-based, and if one was able to do them, they would have to pay quite a bit of money and send labs to specific companies, most likely in the United States, that would be able to find these parameters. But as you can see here, it's some of these are easy to do. Inflammatory markers, histamine, autoimmune markers. Again, we're trying to tease out other pathologies so that we can make the patient more robust in order to recover from their sensitivities. It's difficult to get anti-omyelin antibodies here in Canada without being in a research institution. But basically, this is a good list to start with. To further aid in diagnosis, one could do salivary cortisol, alpha amylase, transthyretin, blood sugar levels after provocation, and also do the blood pressure and heart rate rhythm monitoring for 24 hours. So basically, you can do diagnostic testing even in the brain with PET, SPECT, functional MRIs, and transcranial Doppler ultrasound, as has been reported in the literature. And we use questionnaires quite a bit. So management and strategies for treatment. Treatment strategies. Firstly, reduce the exposure. This is kind of simple. Really, it's not rocket science. Just like multiple chemical sensitivities, you have to remove whatever it is that's causing the patient to be in distress. And we highly recommend a building biologist to come and visit and do home inspections. Individual therapeutic approaches are the best way to go. There's no cookbook approach to this problem or any other environmental health problem, really. That's why it takes us so long to figure out patient issues and manage them. We spend hours with them on the initial assessment. And then we do some follow-ups and, with any luck, some continuity of care in the community. Again, funding is an issue here in Canada. Psychotherapy by itself is not useful, but any mental health support is always welcome if it's what the patient needs and requires at the time. So we use the weed, seed, and feed approach developed by Dr. Lynn Marshall at our environmental health clinic. It's a nice way of looking at methods to get better. So we look at the seeds of health. What are the seeds of health? Well, sleep, good sleep, a clean environment, adequate exercise and pacing, a review of one's diet and drug regime to make it optimum, and a good support system, including oneself, spiritual, medical, family, social, occupational, and financial. When a person is exhausted, we have to look at the seeds of health and see if indeed it's causing them to not get better. So basically, are they living in a polluted environment? Are they eating junk food? Are they working too many hours? Are they sitting around and not exercising? And are they under a lot of stress and have, poor support system? Because once those seeds of health are planted, a person can adapt, but adapt in a relaxed fashion so they don't crash and become exhausted. So we also do a natural detoxification protocol with patients. Depending on the patient, it will be different for every single one of them. And we want to decrease the input of those stressors that we saw in the total load diagram. And we want to increase the output of whatever is in there through things like sauna therapy. So heat, hydration, increasing metabolic conversion rates, so enhancing antioxidant reserves and mitochondrial function, and helping with the excretion of toxins through the bowel and renal function, as well as perspiration. We need to decrease the body burden. How do we do that? Not just by reducing the input and increasing the output, but also helping the body work optimally. So mindfulness-based stress reduction is highly recommended. We give them supplements to help things work more efficiently. We've talked about depuration, exercise, diet, and proper hydration. Removal also of the dental amalgams, the mercury amalgams, or even gold or titanium or any metal in the mouth is highly recommended, using proper protocols so that people don't become sicker after the intervention. And always being aware of genetic polymorphisms. So we often do genetic work with patients, and that helps us to determine what their detoxification potential is and where they might fall into trouble. I've talked about the enhanced natural detoxification protocol, basically eating organic if possible, decreasing oxidative stress through supplements as well, and protecting with adequate amount of calcium, protein, iron, chromium, and some other minerals against mercury toxicity, which often is a situation we see. Increasing fiber for proper elimination of toxins through the bowel. And we've mentioned removing personal care products that might have chemicals. A lot of those can be a problem. Cleaning products, unnecessary medications, helping people manage adrenal fatigue. So if they're going to have to maybe take short-term or long-term disability for a bit to rest. Herbal medicine is very helpful here. Homeopathics also can be very helpful with people that have sensitivities. Supplements and medication for heart arrhythmias have been shown to be useful, we have found. So the supplements that I've recommended, or medications rather, are beta blockers, bisoprolol, a very small dose, 1.25 milligrams to 2.5 milligrams. Daily as needed for acute episodes, a little bit of propranolol, maybe a quarter of a tab or half a tab, so 2.5 to 5 milligrams, QID PRN. And then calcium channel blockers, a very small dose of diltiazem, 15 to 30 milligrams daily PRN, can take the edge off so a person can actually function. There is quite a bit of a histamine release in these patients, so antihistamines can be helpful for sleep and for itchy skin, which they tend to have quite a bit. Electrolyte imbalances and food sensitivities have to be also corrected, and that can be done through various dietary measures. For sleep, melatonin is useful, magnesium as well, and herbs such as passion flower, lemon balm, rhodiola, ashwagandha, as people can tolerate it. Now, as I said before, because there's a lot of overlap between MCS and EHS, the therapies that we use, we have to be very, very careful and use only very, very small doses, one at a time, to make sure that the person does not have any adverse reactions. Phosphatidylcholine and serine and taurine are very helpful as well to help calm the system down, calm the brain, and help people relax at night to sleep. Psychological support is really very important for these patients because they've gone through so much stigmatization and confusion and loss. A lot of our patients are homeless and looking desperately to find safe places to live. So some CBT is helpful around the cognitive distortions that may have arisen and issues around disability as well and social isolation. Mindfulness-based stress reduction is really critical, because it helps with just the overall frequency, restoration of the body when it's trying to relax. And the more mindfulness and meditative practices that people do, the better the response when it comes to cardiac stressors or emotional stressors, neurological stressors. Everything is improved because the sympathetic nervous system is calming down. Support groups are very important, and grounding is a great method to help with electron balance. So walking barefoot in water, going in the tub, lake or pool, and there are certain sheets that you can use or grounding mats that you can use. So with that, thank you very much for listening, and it was a pleasure talking to you today. Thank you.